Hi, my name is Corey Powell. Today we'll be discussing twin-to-twin transfusion syndrome. Throughout the presentation, you may see it written as TTTS, just to save a little bit of space. Twin-to-twin transfusion syndrome is a complication specific to multiple gestation pregnancies. Twins account for 1 of every 40 to 50 births, but represent 10 to 14% of all perinatal deaths. Twin-to-twin transfusion syndrome occurs in 15 to 30% of monochorionic pregnancies, which is when multiple babies share one placenta, which is what provides their nutrients in utero. So how does TTTS occur? It happens when blood passes disproportionately from one baby to the other through connecting blood vessels within their shared placenta. One baby becomes the donor baby, and one baby becomes the recipient. What effect does it have on the babies? Well, the donor baby doesn't get enough blood, which can cause anemia and growth restrictions in utero. And it's quite the opposite with the recipient, which receives too much blood, which can overload their cardiovascular system and can cause the baby to be large for their gestational age. This slide just shows the different effects that it can have, the syndrome can have on the donor fetus and the recipient fetus. They're basically the opposite of one another. The donor can have anemia, hypotension, oliguria, oligohydramnios, which is too little amniotic fluid, circulatory insufficiency, growth restrictions, renal failure, and fetal demise, which can happen with the recipient as well. The recipient can have polycythemia, hypertension, polyuria, polyhydramnios, which is too much amniotic fluid, circulatory overload, heart failure, and fetal hydrops. So how is TTTS diagnosed? Well, usually it's discovered through a routine ultrasound. There are specific things that happen with this syndrome. There has to be one shared placenta for the multiple gestation. There's also a marked difference in the size of their amniotic sacs, umbilical cords, and the size of the babies of the same gender, which is called discordancy. Discordancy is defined as weight difference of greater than 500 grams, an abdominal circumference difference of greater than 20 millimeters, and a head circumference difference of greater than 5%. One baby will present with polyhydramnios, and one will present with oligohydramnios. The case we're following today is of a 19-year-old mother carrying twins. Both fetuses were female. Baby A weighed 11 ounces with a head circumference of 170 millimeters and an abdominal circumference of 146 millimeters. Baby B weighed 8 ounces, had a head circumference of 154 millimeters and an abdominal circumference of 125 millimeters. Now, these differences don't seem like a lot, but when you're talking about the size of these babies at 19 weeks, it's a big deal. And these both fall under the category of discordancy. Here's a side-by-side of the head circumference of baby A and baby B. It's hard to tell in an ultrasound photo the actual size difference, but if you look to the left, you can see again what I went over in the slide before, the discrepancies in the head circumference and the BPD. This is the side-by-side of baby A and baby B and their abdomen circumference. Again, it's hard to tell just looking at them, but there is a big discrepancy in size. The mother will also have symptoms. She will have a sensation of rapid growth in the womb. She'll have a large uterus for her pregnancy dates, possible abdominal pain or tightness, and swelling in the hands and legs early on in pregnancy. There are also complications to the fetuses involved: premature labor, respiratory, digestive, heart, or brain defects, a donor twin developing anemia, and fetal demise or death for one or both of the fetuses. There are treatments. Amniocentesis is one of them, which involves a needle into the amnion to drain some of the amniotic fluid to improve blood flow in the placenta, which reduces the risk of preterm labor. Laser surgery is another option. It is used to seal off the connection between the blood vessels between the babies. After birth treatments, if both babies survive, just depends on the infant's symptoms.